Hi, I'm Margaret Gunter, and today I'll be presenting on the effect of patient income on opioid prescribing in cancer patients, a systematic literature review. First, some background. Pain is the most common symptom that cancer patients experience, and it's an important part of their care. Current WHO recommendations recommend using opioids for cancer patients experiencing moderate to severe pain. There's already well-documented variability in opioid prescribing practices between different socioeconomic and racial and ethnic groups. But this has not been well studied in underserved cancer patient populations. The research I'm presenting on is part of a larger systematic review that investigated multiple socioeconomic factors affecting opioid prescribing in adult cancer patients. Today, I'm specifically going to be talking about the effect of income. Our systematic review involved a literature search of Medline via PubMed, Embase, Web of Science, and APA PsycInfo. All abstracts were screened against our inclusion and exclusion criteria, which is listed here, and it was screened by 2 independent researchers, and any disputes were resolved by a third party. Our initial literature search pulled in 946 articles. Of those, 181 were removed as duplicates. We then had 765 abstracts that were screened, and of these, 102 made it into our full text screening and were then evaluated. Finally, we ended up with 14 studies that met all of our criteria, and today I'm going to be talking about 10 of those studies, as those were the 10 studies that measured patient income as one of their socioeconomic factors that they looked into. Regarding our results, we noticed one major theme when reviewing the literature on this topic. Cancer patients at lower income levels tended to receive opioid prescriptions more frequently and reported opioid use more often. This was seen in 6 separate studies. Additionally, in those studies that measured the length of opioid use, lower income patients showed increased rates of long-term and persistent opioid use in 4 studies. One of these studies was a 5-stage integrative review, which found 4 studies of its own that correlated lower income with increased risk for long-term opioid use. There are some additional nuances to these findings, however. 2 studies showed an association between lower income and reduced doses of opioid medications. This may correlate with the findings of Vitzthum et al., a study from 2021, which found higher rates of pain-related ER visits in lower-income patients as well. Some other findings included increased rates of urine drug screening, and another study that assessed neighborhood-level accessibility found difficulty filling opioid prescriptions for patients in lower-income communities. In conclusion, our literature search clearly demonstrates increased frequency of opioid use and prescriptions in lower-income patients for longer periods, but at lower doses overall. This paints a complex picture of poor pain management in those experiencing socioeconomic deprivation. These patients may not have access to support measures and outside resources that would allow them to manage their pain without opioid medications. They're also at increased risk of dependence with long-term opioid use despite these medications not fully alleviating their pain, as was seen with the increased pain-related ER visits. Everyone deserves a life free from pain, especially those already suffering with cancer. Inequities in cancer care outcomes like this need to be addressed, and more research needs to be done to assess how these trends impact breakthrough pain and opioid use disorders in our most vulnerable populations. If you're interested in seeing more about the results from the studies included in this literature review, study characteristics are available in this table at the bottom. Additionally, you can scan the QR code attached to our Prisma diagram to see the full references for all studies included.